Have you ever walked into a room and completely forgotten why you went in there? Most of us laugh it off. Oh, that's just me getting older. But here's what most people don't know, and what doctors are desperately trying to tell us. There's a very thin line between normal forgetfulness and the early warning signs of Alzheimer's disease. And today, we're going to talk about exactly where that line is, because catching this early can change everything. Alzheimer's disease is a progressive brain condition that slowly destroys memory, thinking skills, and eventually, the ability to carry out the simplest tasks. It's the most common cause of dementia, and it affects millions of families around the world right now. Here's the thing, though. Alzheimer's doesn't just appear one day out of nowhere. It creeps in, quietly, over months, sometimes years. And during that window, that early stage, there are signs. Signs that most people dismiss as just aging, but they're not. Normal aging might mean occasionally forgetting a name and remembering it later. Alzheimer's is different. And if you know what to look for, you can act sooner. And earlier action means better outcomes. So let's break it down. The first sign is memory loss that disrupts daily life. We all forget things. That's human. But here's the key difference. With normal aging, you forget where you put your glasses, and then you find them. With Alzheimer's, you forget that you even wear glasses. We're talking about forgetting important dates, birthdays, anniversaries, doctor's appointments that you've remembered for decades. Asking the same question over and over, sometimes within minutes of the last time, with no memory of having asked it before. A common example, Grandma calls you on Tuesday to ask if you're coming for Sunday dinner. Then she calls again on Wednesday, then Thursday. Each time, it feels like the first time she's asking. That kind of memory loss isn't a senior moment. That's a warning sign. The second sign is difficulty completing familiar tasks. This one is heartbreaking and incredibly easy to miss. Imagine someone who has cooked the same chicken stew recipe for 40 years. Suddenly, they can't remember the steps. They stop midway through. They get confused. They leave the stove on. Or think about a person who's used a TV remote their whole life, and now they can't figure out how to change the channel. They're not being difficult. Their brain is struggling with a task that once felt completely automatic. If you notice a loved one having repeated difficulty with things they've always done easily, cooking, paying bills, driving a familiar route, please pay attention. The third sign is confusion with time or place. People with early Alzheimer's often lose track of time in a very specific way. Not just the date, but the season, the year, even what point of the day they're in. They might wake up in the morning convinced it's evening. They might forget that an event happened months ago and think it was yesterday. And places become confusing too. Someone might get lost walking home from a neighbor's house they've visited for 20 years. They step outside, and suddenly nothing looks familiar. That disorientation, especially when it keeps happening, is not normal aging. It deserves a conversation with a doctor. The fourth sign is trouble finding words. We've all had the tip of the tongue moment. That word is right there, and then it slips away. That's completely normal. But in early Alzheimer's, this happens constantly, and it goes further. A person might stop in the middle of a sentence with no idea how to finish it. They might call a watch a wrist clock. They might refer to a dog as the animal that barks. If you're noticing someone you love struggling to hold a simple conversation, using strange substitutions for everyday words, or giving up mid-sentence more and more often, that's worth noting. The fifth sign is poor judgment or decision-making. This one often surprises families because it doesn't look like memory loss at first. It looks like a personality change. A parent who was always careful with money suddenly gives large amounts to strangers or falls for telephone scams repeatedly. Someone who always dressed neatly starts wearing mismatched clothes or ignoring basic hygiene, not out of laziness, but because their brain is no longer sending those signals clearly. Poor judgment, especially when it's a new pattern in someone who was always sharp and sensible, is a red flag that should not be explained away. The sixth sign is withdrawal from social activities. This is one of the quieter signs, and one that often gets missed because we assume they're just tired or slowing down with age. But when someone who used to love church, card games, family dinners, or choir practice suddenly starts making excuses to avoid all of it, that's worth a closer look. Often, early Alzheimer's patients sense that something is wrong, even if they can't name it. They feel embarrassed when they forget words, or confused in group conversations, so they pull back. They stay home. They become quiet. Isolation is not just a symptom. It can also make the condition progress faster. So if someone you love is withdrawing, gently reach out. Don't let them disappear. The seventh sign is mood and personality changes. The brain controls everything, including temperament. And when Alzheimer's begins affecting the brain, it can change who a person is. Someone who was warm and patient might become irritable and suspicious. A previously calm person might show sudden bursts of anxiety or paranoia. They might accuse family members of stealing things they've simply misplaced. These aren't character flaws, they're neurological changes. The person isn't choosing to behave this way. Their brain is under attack, and it's changing how they experience the world. Understanding this, truly understanding it, is what separates caregiving from simply managing behavior. Now, here's what I want you to hold on to. One incident doesn't mean Alzheimer's. Everyone forgets a word sometimes. Everyone loses their keys. Everyone has a bad day. What we're watching for is a pattern, a change that persists, a cluster of these signs happening together or getting gradually worse over weeks and months. And the most important thing, don't wait until you're certain. If something feels off, see a doctor. Early diagnosis means earlier access to treatments, lifestyle interventions, and support systems that can genuinely slow progression and protect quality of life. Talk to a doctor. Bring family members to the appointment. Keep a journal if you need to. Dates, incidents, what happened. That information is gold for a clinician. The good news is that early action matters enormously, and there are real, evidence-backed steps you can take right now to protect brain health. Mental stimulation is powerful. Reading, crossword puzzles, learning a new skill, even playing cards. The brain responds to being challenged. Diet plays a huge role. Research consistently supports the Mediterranean diet, rich in vegetables, fish, olive oil, and whole grains, as protective for cognitive health. Exercise increases blood flow to the brain and reduces inflammation. Even a daily 30-minute walk makes a meaningful difference. Social connection is medicine. Loneliness accelerates cognitive decline. Regular, meaningful interaction with friends, family, community groups is protective. And regular medical checkups matter. Blood pressure, blood sugar, cholesterol, sleep quality. All of these affect brain health, and all of them are manageable. Small, consistent habits add up to something powerful. If you've watched this far, you're probably watching it for someone. Maybe it's a parent, a grandparent, a spouse, maybe even yourself. And I want you to hear this. You are not alone. Millions of families are quietly carrying this fear, the worry that a loved one is slipping away and they don't know what to do. The fact that you're here, learning, paying attention, that already means something. That's love in action. And the earlier you act, the more time you protect. More conversations, more memories, more of them. It is never too early to have the conversation, and it's never too late to show up. If this video helped you, please share it with a sibling, a friend, a family group chat. One share could lead to one doctor's appointment that changes someone's life. Subscribe for more honest, helpful health content, because knowing more means doing better. And drop a comment below. Have you noticed any of these signs in someone you love, or even in yourself? We'd love to hear from you. See you in the next one.